Good evening. Let us pray. Lord, we give you thanks, O God, for this gathering of your people this evening, representing the great diversity of your church within and beyond the Presbytery of New York City. Lord, we continue to seek your protection, guidance, and wisdom through this pandemic and in the days ahead. May you grant us patience, peace, and deliverance in accordance to your will. Lord, we express our gratitude and thanks to those who have given so tirelessly throughout this pandemic, for the scientists and researchers who have worked so diligently in developing the vaccines, those healthcare professionals and first responders who put themselves on the front line in caring for those who are still who were sick and those who are still sick. Remember those friends and families who are grieving the loss of loved ones. May you grant them the comfort of your peace in knowing that you are sovereignly in control of our lives each day. Be with us this evening as we hear from our panelists to share their experience and knowledge to us so that we may make better informed decisions concerning our future going forward. Help us to be mindful of not only our needs, but the needs of those around us as well. In the name of our Lord Jesus the Christ, we pray. Amen.
Thank you, Samson. On behalf of the COVID-19 Discernment Team of the Presbytery of New York City, I would like to welcome our fellow presbyter, Bertram Johnson. Reverend Johnson, as many of you may know, is a member of New York City Presbytery, currently serving as an interfaith minister at Union Theological Seminary. Bertram has a long career now in service to the church, and before that, in the healthcare services arena, and with a great focus, I think, in both cases on social justice and social witness. And so we welcome you, Bertram, and we'll invite you to introduce the panel and carry us through the evening. Thank you.
First of all, thank you, Thea, for the introduction. And again, thank you also to Mark and Samson and Brenda for your service to the church in this way through this time of pandemic and helping us discern what does it mean to be the church, both in our social witness, but also in the ways that we come together for our gathering and for our worship. So thank you. I will get to our panelists in a moment, but I do want to, I have a brief slide presentation on the work of the COVID Prevention Network. I'm going to start sharing my slides. And if someone can just confirm. Great. So as you all know, the title of our time together tonight is COVID-19, the CDC, and what do we do now? As Thea said, I work at Union, but I'm also on staff for the Faith Initiative of the COVID Prevention Network. The COVID Prevention Network was actually founded by the National Institute of Allergy and Infectious Diseases out of 4 pre-existing research networks, most of which were focused, or actually all of which were focused on HIV and other infectious diseases. The HIV Vaccine Trials Network is based in Seattle. The HPTN, the Prevention Trials Network, is in Durham, North Carolina. The ACTG, AIDS Clinical Trials Group, is in Los Angeles, and the Infectious Disease Clinical Research Consortium is in Atlanta. Together, those 4 research networks are in partnership with 72 research sites across the US. The COVID Prevention Research Network, or COVID Prevention Network, was actually responsible for research specifically on the Moderna vaccine, and that was developed through their collaboration. Just for a quick review, these are the numbers that were on the CDC website as of today. According to their numbers, there were over 33 million cases of COVID-19 in the US, or in the last 7 days, we've seen still almost 100,000 cases, or like 99,000 cases. According to the CDC, which may be a low estimate, according to some sources, there's nearly 6 million people or 600 million people 600,000 people who've died from coronavirus. And at this point, so I wanted to include this here. This is the good news, that nearly 53 million people have been vaccinated. And these statistics are for the US as a whole. I do want to share with us specifically New York State, because we are all, I believe, in New York State, and want to highlight the work that's being done here. As it relates to vaccinations, at least 57% of our population of the state have had at least one dose. And then we have close to 49%. So we're not yet at half for a full vaccination. According to, this is from the Mayo Clinic website, and according to their information, it seems that, I think it's Vermont has the highest rate of vaccination. And I think overall they're close. They're maybe in the 70s for at least one dose, and then somewhere in the 60s for fully vaccinated. So there's still much to do. And then this does offer context that as we consider going back into public places, whether it's worship or places of employment, whatever those social engagements that you're being invited to now, just be aware that we are still far below sort of the notion of what's needed for herd immunity. And so be cautious. And so you'll get more information as to how you can protect yourselves and your congregation and your loved ones as we go through this presentation tonight. I consider all of you faith leaders. If you're on this call, you are in some way in leadership in your congregation, whether you're a pastor or an elder or a teacher, or if you sing in the choir, you're an usher, or even if you just sit in the pews, you are a leader in your faith community because you're being empowered with information that will help transform your lives and your community. And if you'd like something more specific to your congregation, I am happy, or there are other members of the staff at the COVID Prevention Faith Initiative. I should say that there are actually 7 of us who are in this role similar to me, and then we all have consultants, and you'll hear from one of my consultants later on this evening. And we're interfaith. We represent Christians and Muslims. We've been doing this work to help raise awareness about, when we started the work back in August, I should say, we were talking about the notion of a vaccine becoming available to the public with the hope that maybe within a year we would have something. And so our job has shifted quickly. First, there was one vaccination product, then there were 3. And now we're looking at issues of vaccine hesitancy, but also seeing a great uptake of folks who are willing to make this decision for those who can to get vaccinated. So if there are any ways that we can help support your congregation or you individually, please do let us know, reach out to me. And in this presentation, you'll get more guidelines on what does it mean to take safer precautionary measures to protect your congregation. Vaccine education is always important. And if you need more information on the work of the COVID Prevention Network, I invite you to go to preventcovid.org for more. We're currently scheduled to have 2 presenters tonight, and I'm not sure if both are on, but right now we do have Dr. Lydell Lettsome, who is one of the faith consultants for the COVID Prevention Network. Dr. Lettsome is a medical doctor and a board certified general surgeon with a background of studying Christian and medical ethics. He's a graduate of Columbia University and received his medical doctorate at Jefferson Medical College in Philadelphia. He's a fellow of the American College of Surgeons and is currently the clinical director of Wound Healing Associates in Hawthorne, New Jersey. Additionally, he is an ordained pastor. He has an MDiv from Union Theological Seminary. And in his free time, Dr. Lettsome travels the world, providing free medical and surgical care. He's also the founding director of Van Burt Health Equity Project, and as I said, a faith consultant for the COVID Prevention Network. So friends, I invite you to welcome my friend and colleague, Dr. Lydell Lettsome.
Good evening,
I can see the applause. I appreciate it.
Yeah, right. Hi, my name is Lydell, and with all that Reverend Bertram just said, I will really just go into a few slides, and then after that, I'll save, so depending on what the rest of the panel goes through, would like to really just talk to everyone about things I think should be some perspective concerns and strategies as we really look towards not only sort of reopening, but how we minister to our communities and to ourselves and the new reality that the summer and fall is going to bring upon us. So without further ado, let me share the screen and get up here and bring forth the first slide. And more like, what do we do now? And I want to just go back to how far we are. So these numbers are from July 2020, and it sort of just gave the perspective of percentages and how people were dying and who was dying, but also the number of millions of people at any given month being affected by COVID. And you see in July 2020, almost 10% of the country was being affected by COVID in some meaningful clinical way. And by the time we get to April 2021, the rates really haven't changed. And I'll go back to July in case you missed it because I didn't point it out yet. But you can see here in terms of African Americans, Latino Americans, the hospitalizations and the death rates being 2 and 3 times, even as recent as April 2021, which is going back to July 2020, which was considered the hot time. The ratios aren't much different. So I point this out to say that COVID-19 is still COVID-19. And I think sometimes, given the way that just stuff has been presented and there's really cultural context for the way stuff is being presented, it can help us lose sight of the fact that the virus is still a virus. It's not any more or less lethal today than what it was in April and June of 2020. People are still dying in their prime from COVID-19. As I speak to you tonight, June 10th, 2021, I have 2 people who will be funeralizing their family members from COVID-19 this weekend. So it's still doing what it did. We need to bear that in mind. As the previous slide showed, the people who were vulnerable last year are still vulnerable. People of color are still very vulnerable. So depending on your congregation or your community, bear those things in mind as you open up and look to reconnect. And I give these numbers because I want us all to know that the precautions still matter. The hygiene precautions, the barrier precautions, all of those things still matter. And what matters even more is vaccinations. As Reverend Bertram went through, the vaccination numbers in America just really aren't that great. And I'll show that in a little bit, but I want to just quickly talk about the vaccines. We're about 7 months in. The first ones came out December 20th, and there's been so much hoopaloo about vaccines being 100% safe. And just call me a cynic, I always chuckle at that because I don't know of anything in life that's 100% safe, including Zoom meetings. I just don't even know where people get this random notion of, oh, it's not 100% safe, and I don't understand why they would let some. We just have to really regain our perspective and understand that life is a challenging sport. And it's, unfortunately at times it's just simply not for the weak. So the notion of 100% safe is just an unrealistic benchmark in anything. It's not fatal. That's the thing that matters most to me and my perspective as both a clinician and a scientist. That you're talking thousands of people, and so far the deaths that are being presented are still not clearly deaths that you could say, oh, the person got the vaccine and all of a sudden something that wasn't askew is completely askew and they're gone. So the stories about the fatalities are skeptical, but I can get it because people are dialed in. I got a vaccine, and my wife has learned when she's like, why are you surgeons so tight at times? And I said, well, I teach it to my students. As fun as surgery can be, the brutality of surgery is, it's literally, if you break it, you bought it type of business. meaning that the person could have been not well for decades and their primary care physician could have been mismanaging them, or primary care physician is doing a great job. But the minute you touch that person surgically, for the minimum of the next 90 days to literally the next year, if they die, not only legally, but culturally, people are like, well, you know, they had surgery and they've never been right since. And I think right now we are sort of in that hypersensitivity around these vaccines, that anyone who gets vaccinated, all of a sudden we're all on high watch, that if anything goes wrong with them, we're going to immediately try to find out if the vaccines had anything to do with it. When the reality of it is, they could have died from their asthma and the vaccines had nothing to do with it. They could have died from their high cholesterol and the vaccines had nothing to do with it. So we just have to really be mindful of what is happening with these vaccines, that there's really been very few hospitalizations, and what we are calling side effects aren't actually side effects. These three here are pretty much things that are actually side effects, meaning if you get vaccinated within 24 hours and you normally never had any respiratory issues and you start having shortness of breath, then chances are that is a side effect. If you start having heart palpitations and regular heartbeat and you've never had a heart condition before the vaccine, that more likely is an actual side effect. If you have some type of neurological event, that also is most likely a side effect. If you have fevers, muscle aches, fatigue, nausea, diarrhea, but just don't feel well, that is not a side effect. Vaccines are meant to stimulate our immune system. So these other reactions are showing that your immune system is properly responding to the vaccine. The highfalutin technical term for it is immunogenicity. We like to see people get some type of reaction from vaccines because vaccines are supposed to stimulate our immune system to be able to recognize the pathogen, i.e. the virus, once it enters our body, which I think this slide kind of will show. So here's a little schematic of how vaccines work. It's pretty much we somehow make a weakened form of a virus, and then we inject that into the person's body, into the immune system. Basically, our T cells and our antibodies develop recognition. T cells are great, but why you hear so much about the antibodies and the antibody serum, because T cells are short-term, both short-term in action and short-term in memory. So when we make vaccines, we really look to see, can we get an antibody response, because antibodies last longer in your system. And we're hoping as they will be doing the serum levels and the term just blanked out of my brain, but the levels to see how much antibodies are going through in the titers, that we may not have to do yearly inoculations of people with the vaccines. But right now, the expectation is that people will have to get another round of vaccines next year. And I put that on the table because I want you to prep yourself and your communities and your congregation that if they do follow through with that expectation that you get another round of vaccines next year, that is by no means uncommon. That is not a failure. In fact, several what we view as successful vaccinations have rolled out that way, including hepatitis. So do not spend time worrying that, oh my gosh, if we get vaccinated. Several things we've already made ourselves completely comfortable with. That's how they rolled out. On the right here, it shows that the vaccines are pretty much what they did in the lab was figured out a way to use RNA to make a simulation, excuse me, of the spike protein that exists on the coronavirus. And with that mRNA, it generated the ability to make the antibodies and the T cells that we need if we get exposed to the mRNA virus, to the COVID-19 virus. The beauty of it is with the Moderna and Pfizer group vaccines, 2 doses gets you above 90% efficacy, which is a really good thing to have in terms of, although we know we don't need 100% efficacy, it's a really good chance that not only will you not get a symptomatic version of COVID, but that you won't spread it. And that's my biggest concern with J&J, don't want to create any havoc, is that it doesn't do that in the sense that it's 65%. And so the other two, 1 dose, all the studies show that 1 dose just doesn't hit the 90% threshold. And for me, why that matters to me is that also has me on alert. How much antibodies will you have in your system as time rolls out? So yes, you may be great the first 2 months with one dose, but where are you at 5 months after that? And that is why I understand they put it out there, because Americans, we are right now, for all kinds of reasons, so reluctant and so suspicious of these vaccines. Several of us barely want to get one dose. So I need you to really understand, the one dose is actually a compromise. The ideal is really 2 doses. And I'm not going to belabor that point, but the ideal would be the 2-dose breaking 90%. Bert went over this a little bit. I just want to touch on 3 highlights, sorry. That the country as a whole is only 40% fully vaccinated, building what I said. In terms of people being properly protected, we are nowhere near our threshold. So please bear that in mind as you look for strategies to reopen your worship experiences. And not only that, that number has me doubly concerned, because of course that 43% includes the one-shot Johnson & Johnson vaccines, which are not as efficacious as the 2-shot Moderna and Pfizer. So we're not good. And I don't mean to be the pessimist. I'm just as tired of it as everyone else in America, but we're not good. America right now is okay. But there is a real difference between an okay car and a good car. And I think the safest thing all of us could keep in the back of our minds is not only just worship, but our reunions, our graduations, our picnics, our beach outings, our travel, that we're really not good yet. And that doesn't mean good isn't possible and that we're not going to get there. But right now, June 2021, we're not at good yet. We're at okay. And this one is from 2 days ago. Right now, it was saying that New Jersey and New York were the top in terms of percentage of people vaccinated. And what I love, just to throw politics out the window, you got 2 very red states who are in the top 5. So it gives me hope that that this hopefully is getting less political. As you can see, Florida and Texas are right up there in terms of the largest percentage of people getting vaccinated and their doses given. This slide was an infographic that was live in April. And let me move this over myself. And what is very interesting to me about it, where is churches in terms of the activity risk? The only thing more riskier than a church is the nightclub in terms of the potential to spread the COVID virus. So once again, as a community, we have to understand where we are in the spectrum of things. I do like it in the sense of concerts, sports stadiums, bars. Like, the upside of it is someone said, "Oh man, it's been a long time since I've been to a good party." You can say, "Well, my friend, have I got a good party for you?" But it's like in terms of the opportunity to evangelize to people and welcome them to our Jesus party, we have to recognize our Jesus party does carry a real risk, and set up our Jesus party to be just as safe as we possibly can. Okay, I think that's it. Yes, that's all I want to do right now. And I'll let my partner go ahead after that.
Thank you, Dr. Lettsome. Now I'd like to, again, share my slide. Hold on, give me a moment while I do that. And we've heard from this dear friend, and now we'll hear from Dr. Tonya Taylor. Dr. Taylor received a joint doctorate in anthropology and folklore with a certificate in African American studies or African studies from the University of Pennsylvania. She is an assistant professor at the College of Medicine and Special Treatment and Research at SUNY Downstate Health Science University, and is a co-investigator on the multi-center AIDS and the Women's Interagency HIV cohort studies. Dr. Taylor has been doing this work for over 20 years. And in that work, she's been designing and implementing ethnographic survey and qualitative research for the United States, Southern and Eastern Africa. Dr. Taylor endeavors to be a leader in the area of culturally appropriate, community-based approaches to health disparities among older adults and people living with HIV and AIDS in the US and Africa. And we're so grateful that Dr. Taylor took the time out of her busy schedule to be with us tonight. So friends, I invite you to welcome Dr. Tonya Taylor.
Thank you. Hi, everyone. Thank you. So I'm going to try to share my screen. Perfect. Brilliant. Okay. Christmas, what am I doing? Okay. So good afternoon. I'm not sure if folks can see the title here, but what I'd like to do today is I'd like to briefly, I'm going to maybe repeat some of what has been already said, and I apologize for that, but I guess that any effort to help clarify and dispel any myths or misunderstandings about the COVID vaccine, I think are probably helpful. But today, primarily what I'm going to do is I'm going to go through some of the CDC recommendations for opening churches, mosques, and synagogues. And, oh, Christmas. Okay, I wasn't sure if I needed this, but I have no conflict of interest. So what I'd like to talk about first, and this is just some of the topics, we're going to talk about COVID vaccines, about perhaps, depending on sort of the number of people who are vaccinated or not in your church, mosque, or synagogue, continuing to use masks and social distancing. Going to talk about pods and testing, temperature checks, minimizing share of materials. We need to talk about food and maybe creating lunch to go and making a plan. But first and foremost, you know, really in order for all of our places of worship to get back to normal, real normal, where we can be ourselves and be with other congregants, is honestly if 100% of the folks get vaccinated. And that is really the best way, the way in which like 100% everyone is safe and protected. You know, why get vaccinated? You know, it's going to keep you from getting COVID-19, which is its job. And unfortunately, we've all learned, you know, the ultimate sort of sacrifice in terms of our loved ones losing their lives, but also in terms of the really troubling sort of long COVID, in terms of the sequelae, the sort of illness or problems that develop afterwards. You don't want to get it. So you know, this is going to prevent you from getting it. And the truth is, there's still this notion that we understand everything about the vaccine, and that's not true. This is still a novel virus, and we really don't know its impact on our bodies, and our minds, our brains. And this is something that the NIH is investing a lot of money to be able to look at the long-term impacts. You know, once you are fully vaccinated, you can do what you want. And I know that that is something that we all want to do. It's a safer way to build protection as opposed to natural immunity. And finally, it is the only way that we are going to stop this pandemic. What I'd like to do, and I hope it works, is I'd like to actually show a video. I know you're wondering, what is this big green virus thing here? But I'd like to show a video of the former director of my clinic, basically showing the world in terms of her getting vaccinated. And this is one effective tool that we've been using at my institution in terms of health communication, and thinking about doing more than sending out things where it's all textual, but actually having people that we can relate, people of color, to talk about the vaccine. So let's see. That's so loud, sorry.
this is Dr. Yusuf with another Flash COVID update. I am in the hospital about to get my COVID vaccine. I'm online. It's very busy down here. I'm looking forward to it. I've been looking forward to this for a long time now. I'm doing it for myself, my patients, my family, my community, and for the 300,000 who couldn't do it. So I'm looking forward to it, and I will be back when I'm in the chair. Bye.
We have a very talented gentleman who does our film stuff, and he likes to make it really splashy. So I don't mean to overwhelm you with videos, but I want to talk about the notion of vaccine hesitancy. And the truth is, I think that the skepticism around taking the COVID vaccine is not what we would consider vaccine hesitancy. I think that a lot of our communities, in terms of Black and Brown communities, understand the history of racism in science. And we are also very aware of how we receive differential treatment when we engage with healthcare. This is another video that I think is really valuable, and to a certain extent, it gets at the big elephant in the room, which is racism. And I just want to validate the fact that there's a reason why we are hesitant, and that we want to sit back and wait and know that indeed we're not going to be guinea pigs, or abuse like the Tuskegee, not airmen, the gentleman in the Tuskegee study, or Henrietta Lacks, for example. And so I'd like to just show you this.
Hope and hesitation surrounding the COVID-19 vaccine. Recent surveys finding Black Americans expressing higher rates of concern.
Oh, Christmas. All right, let's try that again.
Hope and hesitation surrounding the COVID-19 vaccine. Recent surveys finding Black Americans expressing higher rates of concern about getting vaccinated. The NAACP hosted a virtual town hall last night, hoping to overcome those fears, featuring the African-American doctor at the center of one of the biggest vaccine breakthroughs. TJ Holmes is here with more this morning. Good morning, TJ.
Good morning. And the community most impacted by COVID, least likely to take the vaccine. And to understand that, you have to go back to one of the ugliest chapters in medicine in this country, where the government deceived and then allowed Black men to suffer and even die from a disease. So now there's a desperate effort underway to get the African-American community to trust the science. And the response is oftentimes, yeah, but we remember the history. A new push this morning to help African Americans in particular understand the coronavirus vaccine, seen as the key to stabilizing the pandemic.
These stages of these clinical trials and the outcomes of these clinical trials and what the FDA requires to move to the next step has been driven by science and nothing else.
The NAACP assembled health experts for a virtual town hall that included Dr. Kesmikia Corbett, a researcher at the National Institute of Health and a lead scientist in the development of Moderna's coronavirus vaccine. Dr. Corbett imploring people to trust the science.
Just because it has been rapid does not mean that there has been any level of irresponsibility in regards to this development. If you know a healthcare worker or someone on the front line who is getting the vaccine, to ask those honest questions.
With 35% of Black Americans saying they wouldn't get it even if it was deemed safe by scientists, and 71% choosing to wait and see how it works for others, Black doctors are at the forefront of this renewed push to build trust and ensure safety, some opting to take the vaccine with the world watching.
On a certain level, Black Americans have been traumatized. So even if you are presenting some people with, this is the data, we're showing that it's safe and effective, that's not enough.
The skepticism attributed to a history of medical racism in this country, the Tuskegee experiment, where for 40 years, the government allowed hundreds of poor Black men with syphilis to go untreated so scientists could study the effects. Some died, went blind, insane, and developed other serious complications and even passed the disease to their families. This resulted in a presidential apology.
The American people are sorry for the loss, for the years of hurt.
There was also Henrietta Lacks, a mother of 5 who in 1951 sought treatment for a tumor. She passed away later that year. Scientists, without her consent or her family's knowledge, harvested her cells for medical research. Cells so rare, they led to medical breakthroughs, including the creation of a polio vaccine. Black communities among the hardest hit by this pandemic. And in order to slow the spread of this virus and build trust, doctors say these conversations must continue.
It is at no fault of yours that you do not trust a system that has done you and your ancestors wrong for hundreds of years. I would consider to be the onus of us on the side of the science and the vaccine developers to earn the trust back.
And let me say the name of Ernest Hendon. In 2004, he was the last survivor of that Tuskegee step.
So excuse me, I'm gonna try to move on. I showed that particular video for a reason. And it is because I think that we, instead of telling our community what to do, take the vaccine. I feel that if we are going to really achieve the level of vaccination in our country, that we have to be honest about our history, and we have to be honest about what has happened and why this is a barrier. I think if we're honest and we talk about this, I know in my particular institution, most of our physicians took the shot, and about all of our PAs and nurses refused to. And we're doing some research, and most of them are very angry. They're angry because they were not given proper PPE. They were angry because they saw, lots of brown and Black people die, perhaps in a way that they didn't agree with. And I think that it is really eroded also some trust inside the healthcare system. I wanted to go through just quickly some questions. These are frequently asked questions because I know folks have them still. And one of the first questions in terms of people not wanting to get vaccinated is, I had COVID, I recovered, I have my natural immunity thing, so I don't need, to get the shot. Yes, you do. The truth is, natural immunity does not protect you the way that the vaccines will. And I believe the gentleman who spoke before me, spoke quite eloquently about sort of the efficacy of these particular vaccines. If I'm pregnant, can I get a COVID shot? Unfortunately, there has been a parallel pandemic of misinformation. And a lot of this misinformation has really prevented us from being able to disseminate correct information about what's going on. And this is one of those things that was sort of linked to this intentional misinformation, trying to scare and potentially pregnant women or pregnant women that somehow taking the vaccine would result in infertility. The truth is, yes, if you're pregnant or thinking about getting pregnant, you can get the COVID vaccine. And I just want to say, because I am not a physician, all pregnant women, before you do anything, should of course first consult with your provider, just in case there's some other issues that require perhaps maybe a different approach to the vaccination. If I have an underlying condition, can I get a COVID vaccine? So to me, this is a really challenging question, because I feel that we've tried to do so much to educate folks about the fact that sort of our disproportionate levels in terms of disparities with these underlying conditions such as diabetes or hypertension, cardiovascular disease, severe respiratory problems, that these can indeed make you more vulnerable to the virus. And so absolutely, we hope that people with underlying conditions will seek to get vaccinated. Again, I have to tell you, you need to consult with a doctor to make sure that everything is okay. I just want to also emphasize that if you have a history of allergic reactions, this is something that you need to talk to your physician about. And I think that that's really it. But again, you talk to your doctor. Your doctor is, I think we've done a study where 95% of the people identified their doctor as the one person that they trust the most with COVID information. Can I choose which vaccine I get? Now, several months ago, we would have said no. Several months ago, we would have said, just take whatever you can get. Don't worry about it. If it's J&J, if it's Moderna, if it's Pfizer, just take it. However, now you can actually request if you'd like to get Moderna or Pfizer. But I just want to emphasize, or J&J, that, all of these vaccines are safe and effective. Okay, and actually the formal position of the CDC is that they don't recommend one vaccine over another. Do I have to get both shots? And again, I think our speaker really spoke about this particular point. Yes, please get both shots. It's actually in the second dose that actually the full effect in terms of sort of like building up your body's ability to be protected against this virus. And so we really strongly recommend. J&J was an optimal option because it was a one and done dose. It is true that it has 65% efficacy compared to Moderna and Pfizer. Today, I listened to a report sort of talking about how, in particular, they're going to be promoting both Pfizer and Moderna, which were the RNA vaccines. That's another myth, the confusion about RNA and DNA. Will this vaccine change my DNA? Very different thing. RNA is basically like the envelope or the message with the instructions. It goes in, it creates this information within your system, and then it just disappears, like instructions on how to build something from IKEA. Update on J&J vaccine. So despite the fact that it might not be as efficacious or effective as Moderna and Pfizer, the truth is, from a public health perspective, we were all really proud that J&J stopped. They did what they needed to do to make sure that it was safe. And that is what, there's so much concern about the safety of these vaccines. And regardless if J&J will not be promoted, the truth is, as an entity making these vaccines, they went above and beyond demonstrating their concern for safety. Now, with J&J, there is a recommendation that women younger than 50 should be aware of this rare risk of blood clots, and that there are other choices that you can take. How long will the protection last? The truth is, we don't know. But let me say a reason that will, so there have been a lot of studies, and those studies, those initial studies testing the vaccines, they've continued to follow these individuals to actually determine sort of, if they still have protection or not. So if you'd like to think of it this way, there's a cohort of really wonderful individuals who volunteered for these clinical trials that are basically going to signal when it is that we will need to have a booster again. Do I still need to wear a mask if I'm fully vaccinated? Oh, I'm so sorry, my kids. So prior to the huge announcement, was it last week or the week before, about no longer needing to wear a mask if you're fully vaccinated, we would have said, yes, please continue to wear a mask. Because the truth is, even if you are fully vaccinated, that doesn't mean that you cannot get infected with COVID and that you can't spread it to others. It just means that your experience with COVID will not be severe and that you will not die. Please close the door. Thank you. Sorry, kids. So now, no, it's a weird place we're in now without wearing masks. But the truth is, you know, depending on where you live, depending on sort of the vaccine uptake in particular communities, I personally still wear my mask, and I think that we need to do what we need to do to feel comfortable. I have 2 children who've not been vaccinated, and I want to make sure that they are safe. And so I'm sometimes wear masks because I'm trying to take care of my kids. And yes, if I, as soon as the vaccine becomes available for kids, I am getting these boys vaccinated. This is a video talking about what to expect after you get the shot. And I thought that it would be helpful, but to just sort of talk about some of the side effects. I think I'm going to skip through this, but basically, you know, the typical side effects include like redness around the injection shot, chills, swelling, tiredness, fever, headaches. These usually just affect you. Oh, Christmas, my computer is about to die. I'm so sorry. I have kids. And oh, Christmas. Hold on a second. Oh, wow.
It's quite dear, your use of Christmas as an expletive.
Oh, because I grew up with people in the church, and so I had to be very, very considerate about that. Sorry.
You're better than a lot of church
Okay,
people.
so I've lost my light as a result of this. But what I wanted to say, to get back to the CDC recommendations, you know, if possible, going outside. And I know that here in this urban, densely populated sort of context, that is not always available. I know that some churches do have little gardens in the back, but you know, it I think would be a smart plan for churches and synagogues and mosques to think about just, you know, our new normal is not to be scrunched together, that we should really be respectful in terms of keeping some social distancing. Now, I spoke, I hope, convincingly to rethink getting a vaccine. I hope that for the church leaders on this, or faith leaders on this particular call, that you will think seriously about creating policies within your churches in terms of trying to reach the goal of 100% vaccinated. But I understand that that's perhaps maybe a difficult bar to reach. So, you know, in the event that there are people who are really just adamant about not getting masks, they should probably wear masks themselves if they come in. If they're going to, they want to come to church, I think that probably the best way to not alienate them, because we all need the social support of our faith communities, is to make sure that maybe they have a place in, you know, where they can sit and that they can socially distance and that they can wear masks. And of course, like, adhere to the other CDC recommendations that we need to continue practicing. It is the one sort of silver lining from this horrific pandemic, is that people now focus a lot more on washing their hands. And so we barely had any flus or colds last year. And I think that that's really important. I want to also sort of say that among your congregants, that you might want to share with them sort of ways in which they can think about creating sort of safe groups of individuals who will maybe work together, and that they will, as a group, be not socially distanced with themselves. And I was thinking in particular of sort of choirs and so forth. You know, the issue with choirs, because we do know it's airborne, I think is a little tricky. If everyone's outside and we're singing outside, no issues. If you have a huge choir and not everyone is vaccinated, I think that those are things that will really be need to take into consideration. I also want to mention that there continues to be free testing in New York City. I put, you can go to nyc.gov. There's also, you can text 855-48, and you know, you want to make sure that you go to Indeed, one of the NYC Test and Trace Corps sites, because other sites might charge you. But at the NYC Test and Trace Corps sites, those are free. And you know, absolutely call in advance to sort of figure it out. You know, there's also mobile testing units, and they're supposedly in every borough. And I think for our older folks who might not be able to get out, I think that that is something that's really important as well. Temperature checks. Oh, wow, this image looks really fuzzy. This is a gentleman in front of his church greeting everybody with his temperature check. You know, one of the reasons why temperature checks, you might want to continue with this particular practice, is that for those individuals who did not get the shot, I just want to remind people that about 40, I think the statistic was somewhere like about 45% of the people who get COVID are asymptomatic, which means that they're not showing signs of COVID and they're completely unaware. That is a really high number in terms of with any disease where you have, I've never heard of like such a high number of asymptomatic sort of, the percentage of asymptomatic cases, and it's really, really large. So it's just one of the things that's really striking and horrific about this particular virus. So temperature checks would be good. And it's, you know, sometimes people are not aware. They're not aware that they're running a little hot, that maybe they've got a little sniffle or something. And so this is also something else that you could do. Maybe people are rushing there, you have them sit down, you do one test, you come back, you do another test. Maybe they're just really hot because they're wearing too many clothes. And then finally, if food is offered at your church in terms of fellowship after you coming together, I think that it is really important for folks to think about maybe packaging meals to go. I know that this is a huge part of the fellowship, but you know, when we eat, and if we're not vaccinated and we're infected, this is one of the ways, especially we found in hospitals, that a lot of providers or critical care, part of our critical care team, were inadvertently getting infected because they were going into these little small rooms and eating their lunch and not thinking about the fact that these little rooms were not well ventilated. And, you know, if there's a possibility for people to go outside again, I think that that's a good plan. Maybe if your venue is large enough that you can do social distancing, then perhaps maybe eating together, but maybe making sure that there's a limited number of people eating next to each other. And finally, the CDC recommends that that you minimize sharing particular materials that are commonly shared. Like worship aids, prayer rugs, Bibles, hymnals, etc. Encourage folks to bring their own, or you can make photocopies. That you should modify your method of collecting financial contributions. Instead, some have proposed like a stationary box where people can just put the money in, or electronic methods. And finally, I think every venue, every faith community needs to figure out exactly what they want to do in terms of the physical contact, shaking hands, hugging, or kissing. And I think that as more people within your community get the vaccine, that you will be able to get back to kissing and hugging each other. And I think that that should be our goal. Well, unfortunately, like the top of my screen is preventing me to read this. So these are some last suggestions. It's really important to make a plan. I put here the cover of the New York Annual Conference, COVID Guidelines for Church Reopening. These, however, were formulated last year. So of course, this is pre-vaccine and pre the new CDC recommendation that if you're fully vaccinated, you can take your mask off. But nonetheless, I think that there are some things that are really important within this plan. And those include having a plan, establishing procedures in advance for in the event that someone is sick, to make sure that they get home safely, or, taking them to a healthcare facility. It's really important that if there is a confirmed case of COVID in your place of in your faith community, that you notify the local health officials. The reason why we do this is that we really do need to understand in terms of the continued spread of this virus. So you can help us understand if we are meeting our public health deliverables. And then finally, if someone in your community gets sick, you need to, in addition to calling the health officials, you need to also let individuals and let perhaps maybe your whole community know that there's been a possible exposure, and to recommend people who were exposed to that individual to stay at home and to self-monitor and follow the CDC guidance if symptoms develop. There's very explicit sort of like guidelines in terms of when people can come back and discontinue their home isolation. I suspect that we're going to be Zooming. We're going to continue to Zoom with our faith communities in the future. And I think that it's opened up a possibility for a lot of people who physically were not able to get to their places. And I do research with older adults, so thinking about some of these barriers in terms of physical function, and inclement weather, other things that happen, you might have to, if you have cases within your community, you might have to go back to virtual, and you can use virtual and also in-person meetings. I think that is all that I wanted to share. Yeah, I think, do we have time to have a conversation and to have people sort of ask specific questions?
Yes, we do. And I
Okay, because I think that for Dr. Lettsome and myself, I think that, to be able to communicate with our faith communities, to be able to identify what is specific and unique to their communities, I think would be helpful.
Great. And I have some questions, and I'll invite everyone who's in the chat or who's attending the webinar to write your questions in the chat. And Mark and Samson are there to try to attend to those, and we'll maybe called upon to answer those, and hopefully we'll be able to get to as many as possible. But I do have some that have come in prior to our gathering. And the first question relates to communion. which is, it's a communal experience in worship, and assessing risk. And do you have any suggestions on alternative methods for practicing communion? A number of churches have been, over the time of pandemic, have been doing communion individually. So a person at their home would have their own bread and juice or whatever elements that they're using. One suggestion was that you bring your own if you are going to be worshiping in person, that you could bring your own. Or is there another suggestion that you would think of that would help reduce the risk for infection? And I'll pose that to
I was thinking about communion. I'm sorry, Dr. Lettsome, that I'm jumping right in. Yeah, maybe it was just what my grandmother's church did, but like we had the little cups back in the day, like this was back in the 70s or 80s. We always had these little cups, and it was always individual. I don't know why. And we would line up around, we'd come and get our little cup, and they'd break the cracker in our hands. You can wear gloves. And then drink your grape juice or whatever as you're walking back to I got grape juice, back to the seat. I think that, there could be safe workarounds. And I don't know in terms of different religious traditions, in terms of how important it is to have one individual do this. And so I just want to share one very short story. So I'm primarily an HIV researcher. This is not my first pandemic. And I did my research on AIDS, HIV and AIDS in Zimbabwe with traditional healers. And a lot of the traditional healers had practices that actually put them enormously at risk for getting HIV. And one was they would do this thing that was which is like almost like cupping. If you know what cupping is, you make a little incision, and lots of different traditions will use sort of tools or something to be able to have the same effect. And I thought that was really ingenious to watch these traditional healers in Zimbabwe modify their practice to and use tennis balls. It's like so cool. And, and so I wonder if our faith communities can also think of ways to modify practices that will continue to protect them and others. It might seem kind of going off script and not the way that it should be, but I think that until we get out of this pandemic, we should think about, taking care of each other.
I think a couple things, and to the most immediate thing to your question, there's the celebration cups, and one of the most unique things I saw with the celebration cups was how they had the health team sanitize them beforehand, and they were put into little Ziplocs with a napkin for everyone. And when I think of communion and baptism, I would say to all of us as clergy, one we got to do is really put our ministry first. And sometimes for so many of us, we confuse our ministry with the building and the organization. And the building and the organization is not actually the ministry. The ministry is the people. And it's making the people feel connected, and it's making people feel the Spirit of Jesus in their lives. So focus on how your worship experience and how your non-worship experiences can keep the people in your community connected to the true source. And I think as you talk about that and put your heads and hearts to that, you may find some amazing ways to not only reinvigorate your ministry, but maybe even expand your way your ministry evangelizes. Like this, one of my friends always says, every crisis represents a lot of new opportunities. And one of the new opportunities about COVID that I just enjoy is that it's forced a lot of clergy who just did not embrace digital work to get it. And so one of the things I would say is continue to maximize your digital experience. Continue to maximize and prioritize your digital platforms and experiences, because Barna has tons of research out there about how that's that's the new normal anyway for a lot of people, that they're not always going to go physically attend something. So focus on that and put the safety of yourself and your congregation first. And I think that will speak far more volumes to the people we minister to than saying, oh, we all ran up and hugged each other to spread the peace. It's just pause for a moment and think of what that means in the sense of, okay, we had a great spreading of the peace, but now sister so-and-so and brother so-and-so went to the ER 5 days later, and we're concerned it might be our gathering. And how does that sound from the pulpit? And how does that affect the confidence people have in you as a leader? So don't be too quick to set yourself up for a sabotage scenario.
Thank you both. Dr. Lettsome, I'm going to direct this to you, but I mean, both are open or welcome to respond. There's a question that asks, do the vaccines protect from the different varieties of coronavirus that appear? They're cropping up,
the variants?
Yes.
Is this a question about the variants?
Yeah.
They don't have proof. And that's the problem.
Yeah. I'll start off and then I'll let Dr. Lettsome, because I have a feeling that he has a little bit more of the science. So, the variants are a real issue, which is one of the reasons that we really had high hopes for J&J, because that particular vaccine was effective, even with that particular variant. I know that Moderna did come out and say that they another dose, a booster dose, would actually provide protection. I was surprised not to hear Pfizer jump in at that particular moment. And I don't know what's going on with Pfizer. It is concerning that there are people in our country that would put us again at risk for another version of this virus that is more virulent and lethal. And I don't really understand that. So I guess everyone here, we will pray for those folks. But it is a concern. To my knowledge, Pfizer and Moderna, Pfizer has not been tested with the variants. There are, Dr. Lettsome, how many variants are there? There are, I think, 4 or 5, but they're like, no, they're more than that. There are 2 really very problematic ones. And so our concern is around those. Dr. Lettsome, I'll let you sort of finish.
So one of the things the community has to recognize, and I've been doing these things since last fall, specifically to the vaccines, and I would always say to people, viral variants are how viruses live. So one of the things that really disturbed me about the news cycle about the variants was just the media's perpetration, like, oh my gosh, this is something so unexpected and we're all going to die. No, variants are how viruses live. That's just what they do. So to what I was saying earlier about us having to get boosters and titers, nothing new. Look, we get flu vaccines every year. Why? Because the flu vaccine, the influenza virus, is something that just constantly variates. And the SARS and the corona, which is really just makes us just this wonderful nightmare. It's actually a blend of 2 things, is also known for being highly variant. So one, the variants are not something abnormal to the science and just the way this works. The second thing that the news cycle disturbed me about is they just threw it out there. Oh, people are just dying and these variants. No context of, well, who are these people? No context of sharing that as this thing was running through Europe. At the same time, Europe was not really well vaccinated, and how as the vaccinations of Europe has picked up, amazingly enough, the variants aren't running as wild anymore. So there's a lot of things that are not being said as these stories run through our community. And the other thing to caveat is, I've always shared people, Pandora's box is open. And I know that's really scary, particularly if you're not a lab rat, to hear that, but it is. Like, this is what it is. This isn't going to end quickly. It's never happened. Polio didn't go away quickly. Measles didn't go. We have been fighting measles for 30 years. And we almost had it eradicated until the anti-vaxxers said, we don't believe it works.
Yep, in Brooklyn, in my borough.
So this is not new. And as we look to minister and schedule our lives, I would say that just expect this to be something we're going to be dealing with on a significant level for easily the next 3 or 4 years. Because one, it's how viruses work. We're going to have multiple modulations of the vaccines. We're going to have some titers adjustments. So that's the bad news if you're not clinically aware of just how it goes. Here's some of the good news with that, though. The vaccines and the vaccine cohort that Dr. was referring to, we got like 100,000 people being tracked, minimal. And that may not sound great to you because you're like, okay, there's 6 billion people on the planet, but we don't normally do that in medicine. The study where we changed how breast cancer surgery was done only had 1,700 women. The largest study on the hepatitis vaccine was 15,000 people. We are well and above in every way possible the numbers, the data, the monitoring that we have ever done for anything in clinical history. So,
and that's for all of the vaccines. So
exactly.
like what Dr. Lettsome is talking about is, you know, the combination of all of these different vaccines that were individually like developed, you know, AstraZeneca that's not even here or others. We have just so much, you're right, there's this hope because we do have information, and these individuals have been basically with the vaccines. I'm not sure, like, would you say like probably like there's an 8 months or maybe a year lag?
Yeah, they were on these vaccines actually as early as January, and some of them even 2019.
Yeah.
But in Morehouse School of Medicine is devoted pretty much in almost a half of one of their departments to doing nothing but studying the vaccines. And a lot of schools are doing that. So I know it's scary to wake up in the morning and see someone on Good Morning America, Fox News, or whatever it is, and saying, oh, breaking news, blah, blah, blah. But these people have to earn ratings. And half the time, they really just do not even know what they're talking about.
Yep. Can I say one thing, though, which is that we live in a very privileged place. We are privileged in the fact that we have access to the vaccines, that we have access to effective treatment. If you get, you know, COVID, that you can go get these I always mispronounce it.
Antibodies, monoclonal antibodies.
Monoclonal.
I see something else and I speak other languages, and for some strange reason, that word is never coming out of my mouth. But the thing is that, you know, I work in Sub-Saharan Africa, and Sub-Saharan Africa is the place that is least being invested in terms of access to these vaccines. Of course, like there's been a lot of news about what's going on in South Africa, but South Africa is not indicative of what resources are happening around in other places. South Africa is, you know, one of those middle level countries. They've been, you know, because of HIV, they've built up huge in terms of science, in terms of so forth.
Industry or
and
resources.
Distribution. But, I work in Zimbabwe, okay? And, and I am concerned because of what recently happened in India. And so my concern is really about the global picture. And I'm really happy that today, I think it was today or maybe last night, it's all blending together, that, our country has taken the lead in terms of trying to address what is happening globally, and that we think about our privilege and the fact that, yes, the variants might not stir up a lot of mess here in the United States, but what happened in India was absolutely horrific. And, I know people who lost friends there, like family and, colleagues. There's a colleague at Rutgers who went over there to take care of his 50 years infectious disease doc and went over there and was exposed to the variant, and he was vaccinated. So I am concerned about the variants and concerned about what's happening in the developing world. And we have to rise up again and be those, moral and ethical leaders in terms of making sure that everyone is taken care of. We're not going to get out of this pandemic if we only selfishly look inside and only take care of Americans. We're going to get out of this pandemic if we play our role in terms of helping the rest of the world.
And I think part of that means us as the church in the U.S. or people of faith in the U.S. doing what we can to, be responsible for the health and well-being of our congregations and our communities. In that regard, I want to ask a question. There are questions about wearing masks while singing, and also the concepts of pods, small groups. And we only have about 8 minutes left, so I'm going to encourage you to be as succinct as possible as you respond to
that's what I wanted to.
Masks while singing, and then small folks who are functioning as small groups within a church. Either of you.
So one of the things I wanted to touch about with that is you have your healing aspect that you have to think about as you open up, and the mass. I would say prioritize to talk about vaccination. Make it a part of your worship experience. If you're vaccinated as the church leader, say I'm vaccinated. Do not resist polling the congregation. Hey, how many of you are vaccinated? Also, use the information that's available to you. Go on your county or point to people in your health ministry. Go on the county's website. Find out how many people in your county are vaccinated. The painful reality is people are lying. So you just can't say, hey, raise your hand if you're vaccinated and trust that.
Yeah.
Don't hesitate to ask. The pod speak to was the thing of the choir. You really don't want the choir wearing masks because they're not going to sound great, but say, hey, we do it with tithing. Look, you want to be someone who's singing, you want to be someone who's ushering, you want to be someone who's preaching, I need you to get vaccinated. Lead. This is physical salvation to me. Just like we don't have any trouble leading when it comes to spiritual salvation, this is where we have to step up and help people live their healthiest lives. Raise that standard of expectation of getting vaccinated. But then before we get off this, I just really want to stress to us, we're opening up to grieving families, that people who do not have loved ones. We're opening up to people who have residual of the sickness, people who've gotten amputations, who now have bad hearts, bad lungs. And finally, the biggest thing that we don't want to overlook as we open up to, we're opening up to people who are unemployed and people whose financial picture has been completely devastated. So think creatively of how you minister to those really big gaping wounds that your congregation has gone through in some way. It's touched almost everyone. And I don't want to close without us thinking about that. Oh, we're going to sing, we're going to worship, we're going to have communion, but people are broken. And what's the point of that if we don't address the brokenness?
Thank you.
That was brilliant. And I think I can't say much more there. You know, I think leading by example, and the truth is the second most trusted person in the research that we've done has been their, you know, faith leaders. And I think that absolutely people need to see that you are vaccinated and that they will follow you. We want everyone to be safe and healthy. And I think that that kind of role model and to have real honest conversations with people, because people will, you know, there's this social desirability. They'll tell you what you think you want to hear as opposed to because they don't want to disappoint you. But the truth is we need to have some like real trust. And to have trust, we really need to be honest. The pod thing was just a suggestion. If there are, depending on how your communities are organized, if like the folks working in the kitchen, you know, are just really close to each other, and I've worked in lots of kitchens and restaurants, you know, and just thinking in terms, I know that restaurants are actually doing that in terms of creating pods, in terms of the people working on the line, et cetera. So you have to think about, you know, if the kitchen ladies don't want to get vaccinated, then they need to be a pod. But, you know, it's, again, you know, leadership. Everyone needs to, for us all to be safe, we all have to get vaccinated. And if they're not vaccinated, they should wear a mask.
And maybe even if they are vaccinated, they should wear a mask, like as a general policy.
You know, I'm not going to give up on the mask. I didn't know that I was severely at risk because my mother never told me about the severity of asthma. And I literally, I'm you know, I'm an academic. I do this stuff, and I really didn't know my own personal risk. You know, at the beginning of the pandemic, you know, I, you know, bought life insurance, and I wasn't sure if, you know, when I might have to leave because I didn't want my kids to see me sick. It was really traumatic. I lost 3 good friends, 5 neighbors, and 16 colleagues at my institution. I'm sorry that my kids in the background have distracted me, and maybe I'm just really tired. But all this is just sort of say that I will continue wearing masks, and especially in the winter months, because I have a very fragile respiratory system. And I know Dr. Lettsome is going to be like, Tonya, how did you not know you didn't have severe asthma? But I used to get annual respiratory infections where I was literally on prednisone for several months every year. Now, prednisone is not something that like you just take. I mean, it was a huge flag that my asthma was really serious. And, you know, I didn't get sick over the winter. And, you know, I've got 2 like disgusting little boys that still pick their nose and eat stuff. And like, I don't know what they do, but, you know, yeah, I guess there's nothing I can do about that. But, you know, I will continue to wear my mask. I work in a hospital, a medical center. I will wear my mask when I go to the school. There are openly communities here in Brooklyn that have been defiant about both vaccination and wearing the mask. I know exactly who they are, and trust me, when I see them, I'm putting on my mask. And, you know, I'm going to do what I need to do. I don't think that we're done with masks. I don't think that we're done with Zooming. I think that these are things that are, you know, we are in a new normal. And the thing is that we want to make this new normal a better normal. Okay. Just like Dr. Lettsome mentioned, you know, this pandemic has revealed the ugliness and inequalities in our society. And it's in our faith communities that we need compassion and love, because a lot of us really struggled.
Mhm.
And a lot of us had harder impacts than others.
Mhm.
And the masks are protective. We can't stress that enough. You know, the vaccines help you not die, which is great. There's no doubt about that, but it's not as if this COVID virus does not affect other parts of your body. One of the most frustrating things for me has been watching young, healthy colleagues now are taking medications.
Mm.
And these are people who didn't spend a day in the hospital.
Mm.
They got COVID, they stayed home, did their 14-day quarantining, but here they are. We're now, one of them, we're 7 months later, still doesn't know why they have cardiomyopathy. Just why risk that for a real mass? For
And also,
a 75-minute worship experience.
Yeah.
Like, why would that be? Like, put the perspective of what you're fighting. You were saying 75 minutes of a mass is too much for me to avoid taking medication for the rest of my life. Does that really sound logical as you hear it in one sentence?
And I want to add on to what Dr. Lettsome said. You know, again, we don't know the profound long-term impacts. This virus is still novel for us, okay? You know, we can intervene if the virus damages our heart and our lungs, medication, whatever. Read about this woman who's acute care provider who had to have a double lung transplant, and she's like in her 20s. But the one thing that scares the bejesus out of me is that 33% of the people who get COVID have some type of neurological impact. That's our brain. We can't fix the brain. Once the brain is damaged, it's damaged. And we don't know the long-term impacts. We have people who have very mild neurological effects, and then we have people who have really serious. My neighbor was a marathon runner, skinny little girl, talks a mile a minute, and she is the worst case of neurological damage that I've seen. She can barely walk down the street without her partner. She talks so slow. And this was someone who was vibrant and talking a mile a minute. I hope she is doing better. I pray that she's doing better, that maybe if she got the vaccine that it relieved some of that. But I suspect when the damage is neurological, that the vaccine might not help with what we call some of these long hauler symptoms. So if that is not an incentive to go get a vaccine, I don't know what is. Okay, because you can't continue doing things if you have this is lifelong disability. Lifelong disability. You're not able to work the way you used to work. You're not able to take care of your loved ones. It's huge. And, you know, so put that mask on yourself as the leaders of your faith community. Take care of yourself, get the vaccine, and then you individually help your community to put the air mask on. And you know, it all starts with you.
And for me, lastly, the Biden administration has prioritized June as the vaccination month, and they've particularly prioritized houses of worship. And it's under I believe it's the We Can Do This is the website, but how they are not only prioritizing houses of worship in the sense of, we know you want to reopen, but in terms of supporting you to actually get a pod or get vaccines done at your facility, or set up where your facility and in your community can go get vaccinated at a site together. So that may be something else to do, and say, hey, we want to open up, and we want to open up in a big way. But we really would like to have at least 85% of you vaccinated. Let's all go do this together Sunday, Saturday. Let's book a date downstate. Let's book a date at Mount Sinai, because the White House is more than dialed in on helping faith communities do that.
And also, if you have members of your community that are housebound, because as someone who focuses on older adults, like to me, this is our most vulnerable. And I feel that sort of, when they were first in the queue, they didn't consult any geriatricians and public health people, because we would have told them, you can't just say that everyone 65 and plus will be able to come. We know this. We know that a huge portion of the patients that we serve are not able to get out.
Yeah. Mm-hmm.
My neighbor, love them. Her mother is upstairs, and I don't know why she still has not received her vaccine. And, I believe it's some hesitancy there, but she can't get out of her house.
Mm.
My great aunt in Philadelphia turned 105 recently. And if I could have wrapped her in some bubble wrap, I was one of the only people she would listen to. When the vaccine came out, she wanted to wait. I respected that, but she got her vaccine. And her church celebrated her birthday with a little drive-by, and they were outside, etc. So we can be adaptive. And my kids are nuts.
Your kids are amazing. You're a great parent. You're a great mom. One thing we haven't really talked about is COVID testing. And I still want to encourage people to get tested when and where you can.
I mentioned that there is free testing.
Yes, free testing.
And I want to just reiterate that not all testing places are free. Mm-hmm. So call ahead, make sure that it's one of the FEMA, sites, or one of they're called the New York, it's something testing core. And you really want to make sure that you're going to a place where you're actually because I think that that's really ridiculous that people are trying to make some money here. You want to go to one of the free testing sites. You're also contributing and helping us in public health to understand in terms of new infections.
Yeah. And so one of the things I want to encourage each congregation or congregational leader, if you are returning back to worship, I would also encourage your congregants to get, if they're not yet vaccinated, even if they are vaccinated, to get tested. I know the story of a man whose parents were in a nursing facility, and the facility had the protocol that if you're coming in, you have to come in with a negative COVID test. And he was like, but I'm vaccinated. They're like, I don't care if you're vaccinated, you have to come in with a negative COVID test. He went and got his COVID test. He tested positive for COVID, although he'd been vaccinated. He wasn't sick, but he was carrying the virus. And you can only imagine, had he gone into that facility to see his parents who were unvaccinated, I believe at that point, or any other staff or any other residents, the impact that might have had in that community. So there's still value in testing, and I encourage folks to get tested, even if you have been vaccinated, especially if you're going to be around people who are more susceptible to the virus.
And I just put a link in the chat that actually has a website that will tell you where the free testing is. I think all over the bloody country. So, but absolutely here in New York, so that you can find a space to get it.
We run over a little bit, and so thanks for everyone who stayed with us. But there's one last question, and I will pose it to both of you and be as succinct as you can. Do you recommend reopening in the fall? Let's say in September, late September, when everything generally kicks off. If you were a congregational leader, what would your response be?
Yes, if I had a plan, and if I was a leader, and if I worked on over the summer, having real small, intimate conversations with people, meeting them where they are, if they need more information, whatever, get them to speak to stuff. Yes, I think that it is possible. And I think that, even as we move indoors, there are things that we can do in terms of organizing the space safely. And I think that we can do it, but we have to have a commitment.
Dr. Lettsome.
Yeah, there's no time frame in my brain. I think right now it's the first thing you got to assess yourself and your community. not only assess your community in terms of the actual data, finding out how people are doing vaccination-wise, but assess the risk averseness of your community. Not every community is the same. You might be pastoring a church where people want A, B, C, and D done, and the other of us might be pastoring a church where people want X, Y, and Z done. So I think this is a great time to start actively polling your parishioners, polling your community, and create your strategy, which means you need a team of monitors. You need the people who are going to hold your arms up just like Moses, people who are always checking the data, people who are making sure that the safety protocols are being done.
Contact tracing.
A sanitization team. You need someone who's going to be the point person to push people to get tested if they have symptoms, or to get tested if they've been in crowded things. You want to have intentional conversations. That slide I showed about risk. Talk to your people about the activities, not only about church, but all the other activities they're doing today. Like, here's one of the weird things you want to consider. If you got someone who works at a nightclub or someone who works at Yankee Stadium, you may not want them,
or even a restaurant.
You may not want them coming to your church, even if they're vaccinated, because they can be getting exposed. And unless they are at a job where they're getting weekly tested, that may be something you have to say. It's uncomfortable, but you may have to say that. Or do you talk to your people about those who are out in the community? Please get regularly tested. So make a strategy, print it out, make it very transparent so no one can go back and say, oh, there was some manipulation. Put it on your website if you have it. And once you, your deacons, or whatever the support is, everyone's on board with the strategy, then you find a date.
Dr. Lettsome, would you recommend for those people who might have exposure because of their work to wear masks?
Yes, I do all the time.
I think, no, but I mean, like in the congregation, I think like if there are people in your community that have an additional risk exposure, I think it's not, that it wouldn't be inappropriate to also ask them to wear masks. Just the same if someone says that they don't want to take the vaccine. But I don't think like you should just give up with that one no. I like keep working on them, because you know sometimes it's just you can say the same thing and then one day it just clicks and they just understand. But I think that we need to do better to really have individuals understand how the virus spreads, and to think even within their home, because this is one of the things that public health could have told people about, in terms of the additional layered risk, in terms of people who were essential workers during the first wave, and they were in intergenerational homes. And if we had been included in the conversation, we could have saved a lot of lives.
Well, I think our work is really to continue to make the church and other faith communities, which are supposed to be places of healing, more engaged in the work of healing, both within our bounds, but also, beyond us. And so, Dr. Taylor, Dr. Lettsome, thank you for your time tonight. Thank you for this rich.
Thank you. This has been my absolute pleasure. Thank you.
Thank you so much. We're grateful to have you.
For everyone. Yeah.
On behalf of the COVID Prevention and Awareness Team for the Presbytery and myself and the COVID Prevention Network, thank you all for being here. I put my contact information in the chat a while ago. If anyone has any questions, please do reach out to me, or you can get me through the Presbytery office. Blessings, everyone. And Mark, did you have a comment there?
Yeah, I have 3 points, right? A preacher, got to have 3.
Okay, I'm timing you.
First, Bertram, you mentioned early in the presentation that you could help arrange speakers from the COVID-19 Prevention Network.
Yes.
Did they use that email address that you gave?
That's it. Bertram@justiceassociates.org.
Secondly, this has been recorded. Once it is processed, we will get this sent and posted. We'll get this sent to everybody who registered for the event, and we'll also get it sent to the rest of the Presbytery. And that will include Bertram's email and the various links that are posted. And finally, if you haven't been monitoring the chat closely, I believe that Elder Lloyd Johnson gave us the sermon we need to talk about vaccination. Jesus didn't need to be baptized, Lloyd reminds us, yet he insisted on being baptized.
Last words, perfect. Thank you. Thank you so much. Your pastor, thank you so much, Pastor Lee. Thank you, everyone. Please stay safe and healthy and get vaccinated.
Thank you all.